that is, how can athletes better share information with you? How and when do you refer a client to another provider, and how do you work with other providers? So this is like from an athlete's point of view in terms of like coming in and when the provider like is working with them to, find or refer them to other providers. So we're going to start with Leanne.
So being a strength and conditioning kind of focus or nutrition for sports, like I usually start out programming or in-person session with some kind of Google form that goes through all sorts of things that compose like the whole person. My approach is generally holistic, and so I'm looking at like, okay, what's someone's sleep habits, what's their stress levels, and so I intake all the information usually before I ever talk to that person in person or set up any kind of program for them, because there's so many factors that are important to how we perform in our specific sports. It's really hard, especially from the endurance perspective. We're putting additional stress, right? Training with stress, and so all stress is important to know. So I try to gather all the information as much as I can ahead of time. In addition to that, like with that Google form, I try to get some medical history, injuries. It's very interesting when you start talking to folks. People forget that they had, a shoulder separation 5 years ago, or they forgot they had a surgery on their ankle, and they just don't think about it because it doesn't hurt them right now. However, like designing programs, it's really important to know all the history, and so I found that like by kind of pulling out this information through forms ahead of time, I usually can kind of get that whole person perspective, and then kind of moving on, like I try to work with that individual as far as like gathering more information. I always want check-ins with people, so I use various like platforms and apps that are web-based, and then try to really cater to what is specific for that person. So I might use Training Peaks to help with like what's heart rate kind of stuff, like speed kind of stuff, depending on what their goals and needs are. It might be some other platforms as well. And then as far as like reaching out to other providers, I'm probably one of the first people that will provide out if I think it's out of my scope. I think it's super important as providers that we work within our realm of expertise. And I know that's like important for probably a lot of people on this panel as well, is that, it's like I am a nutrition coach. However, if I'm reaching a point where I see someone is having challenges, more of a medical kind of concern, or if they've got some other issues, I'm the first. Let's bring a dietitian into this mix. All right, I'm not a physical therapist. I see people all the time who come to me asking like what their injury is, and I'm like, that's out of my scope. Like we can probably nail down a few things, but let's get you to somebody that we can trust, that knows your thing, which is why I think this is super awesome, because it's really important, I think, for all of us to know that we're going to an expert that understands what we do. So as far as that, then working with those providers, it's kind of up to the client or patient on what level they work with me. So sometimes I work directly with that provider and communicate directly through them. I'll just I'll ask my client to ask their provider certain information that I think is relevant to the training plan or nutrition plan. So it's kind of a very moldable to whatever that client needs and what I think I can bring to that whole situation.
Thanks, Leanne. I'm going to have Stephanie go ahead and take the same one on. So she's a massage therapist, and answer you the same question of how can athletes better share information with you as a massage therapist, and how and when you refer your clients to other providers and work with other providers.
So without reinventing the wheel, because kind of really along the same lines, we are all so used to intake forms, right? We fill them out with every clinic that we go to, and they are very important for gleaning information prior to meeting with a provider. But just like Leanne, I want to be able to communicate directly with that person, with that athlete, and find out what's going on right now. So, they fill out the form, and a lot of people start glazing over after page 1. So write down the important information, what past surgeries they've had, past injuries, or what they nutritionally that's different than last year that may be affecting what's going on. So all of that plays a really important part in just that communicating with the client prior to them getting on my table, and then also throughout the process. I'm not one that will just turn off all communication when I'm working on someone. I want to have that open dialogue to say, hey, this is what I'm finding, this is what's going on here in your body, what could be the cause of this, and it might trigger, oh yeah, I had a surgery on that 3 years ago. Well, that would have been nice to know, but you may not think about that. It may not be important to you at this time. So it's just keeping those lines of communication open with the client, with the athlete, to make sure that you are providing the best care. And I'm definitely a huge believer in holistic treatment. So anytime I have someone, it doesn't matter if they're a weekend warrior or a triathlete, or even just someone who might go and ride their bike on the weekend with their kids, I want to know if they've seen an acupuncturist, a nutritionist, a chiropractor. So just getting that background information to know, okay, well, if you haven't tried this, this is something that might be beneficial for you, and being able to, they're trusting us with their bodies, with their healthcare, right? So I want to make sure that everyone is getting what's good for them. It's not a one size fits all. I need to customize every treatment to fit the needs of that individual. So yeah, very much a holistic care provider, and want to be able to get everybody's input to make sure that you're getting the most beneficial treatment possible for your specific sport.
Thanks, Stephanie.